Hi, I'm Senator John Barrasso, an orthopedic surgeon from Wyoming.
And I'm Senator Tom Coburn from Oklahoma, a family practice doctor.
Between the two of us, we have about 50 years of practicing medicine, taking care of patients all over the country. And over the last week, we have been taking your questions on the implications of President Obama's health care law, plus its effects on you and your family. We've received a lot of great feedback, and we're grateful for this opportunity to connect with you, to visit with you about this very costly health care bill.
Our first question comes from Bryce Baird from Oklahoma, who asked on Twitter, what are all the effects Obamacare will have on the future incoming physicians? And it's going to be tremendous, John. You're going to end up spending less time with patients and more time filling out government forms and requirements. The other thing that's going to happen is it's markedly going to change the way you practice medicine. You're not going to be practicing medicine the way you were taught. You'll be practicing medicine to meet the requirements of federal bureaucrats. Nothing could be worse for patients than that setting.
Well, and I'm hoping that people continue to want to go into medicine. We want the best and the brightest, and not just medicine of all. So you want physicians, nurses, nurse practitioners, physician assistants. We need the best and the brightest. And I'm just worried with all the loss of innovation because of the health care law, people may not be as stimulated to go into the health care
I think
field.
that's true.
Yeah. Our second question comes from Kevin McCurry, and he asked on Facebook, as a self-employed individual that pays for his family's health insurance, can you explain to me why my insurance premiums have almost doubled, he asks, since Obamacare passed, yet my plan remains the same? Well, you know, the president promised a couple of things, and one of the things that he's promised is that your health care costs, he said, would go down. Your health premiums would go down $2,500 a year per family. And that's why they did this whole health care law. The idea was to try to get down the cost of care. But the rules and regulations that have come through made it much more expensive. Plus, there are so many new hidden taxes in the health care law, and they're driving up the cost. Senator Coburn and I have just come out with a report called Warning Side Effects, a checkup of the federal health care law. It talks about fewer choices, higher taxes, which go right into your premiums, more government, and less innovation. None of these things are good for America's health.
One of the things you need to understand about the mandates that are coming from Obamacare is that they're going to tell insurance companies how much money they can make. Well, they're going to make the same amount of money, and they're going to add all these regulations and costs for the insurance industry, which they're already having to comply with, plus a tax on insurance industry, which they're already starting to collect on you because they can. And so consequently, the value you get for the dollar spent for your health care is actually going to go down. And so since we don't have competitive forces driving it, we have government mandates driving it, what we're doing is seeing a marked increase in the cost of especially individual insurance, but also very small group plans, because the ability and the cost to run that and the cost to care for that is going to go up under all the regulation and the taxes that will be applied to the insurance market.
Well, we're going to continue talking about the things we consider and are concerned about with this health care law, and I continue to look forward to working with you.
And we hope to be back here doing this again.
Good. Thank you.